Okay, hi. Thanks for stopping by. Today I'd like to talk about my experiences with the Italian healthcare system. Again, these are my personal experiences, okay, and everybody's experience may be different, okay, because everyone's different. Okay, originally from the United States, but I have been living in Italy for 20 years now. Sorry. Um, And my husband's Italian, so when I arrived here, I was able to register with the Italian healthcare public health system. It was about within 1 or 2 months after I arrived here, after I got all of my paperwork in order as far as my permit to stay and everything else. Okay, and all honesty, I admit I was a typical American, thinking that yes, everything in America is the best, that it's like a outstanding healthcare system, even though it was insanely expensive. But um and I knew nothing about the Italian healthcare system when I moved here. I did because I'd heard about the whole socialized medicine, and I live in Lombardy, no, so right on the border, almost on the border with Switzerland. Just to give you an idea, which I've heard has one of the best systems in Italy. And now, lastly, I didn't know what to expect. I thought, okay, public hospital, it's going to be something maybe not like you would see out of a MASH unit, but maybe really old, rundown buildings, not very clean. Doctors that were maybe that studied medicine, I don't know, back in the 50s or something. Well, my husband's parents were older, and in fact, my husband's dad just passed away at 95 about 5 months ago, and my husband's mom, my husband's dad was 95, almost 96, and in December 2020, his mom passed away, and she was 89. They both just died about 3 weeks before their birthdays. So, okay, considering their ages, they had their fair share of health problems. And so my husband and I had to help them out a lot as far as going to the doctor, making appointments, and everything. I had an ovarian cyst, actually, what turned out to be a tumor removed in 2017. It was the size of an orange, turned out to be cancerous. And my husband spent 3 months in the hospital in 2020 during COVID lockdown, because he had at least 3 strokes due to sleep apnea that we didn't know about. And so, yeah, okay, my just opinion is that, yeah, at first I didn't know what to think. And then as started to have more experience with the system, yeah, it's, it was different. And at first I didn't like, I don't say I didn't like, I found it was kind of difficult to realize that, yeah, there are systems better than the United States. And now, 20 years later, if you tell me to go back to live in the States, there's no way I could do it. No way, because I have my I have my fair share of health problems. So does my husband. My husband's now blind and basically paralyzed on the right side of his body because of his strokes. In the States, we'd be living under a bridge because of it. Okay, and the way the system works here in Italy is that it's paid with the tax money, so the euros collected when you work. The system is automatically takes out money for that, and everybody's covered, so you don't have to worry about, okay, I need stitches, I need to go to the emergency room. Oh, can I pay for that? No, you go get your stitches. Stop. The ambulance, if you need to take an ambulance, you call. Here it would be 118, which would be the American equivalent of 911. The Red Cross comes, picks you up, and takes you. God knows only how many times we've had to call ambulances for my husband's parents, also not once for my husband. And again, there's not even, they don't even ask for any money, nothing, zero. And it's just the opposite here. I've heard of people in the States calling an Uber to go to instead of an ambulance. Here, you just call call the ambulance, and they take them to the nearest hospital. And and my only complaint is the lack of organization. That is getting better, especially only because of COVID. That is getting a lot better. That is, compared to before COVID, you would, for example, if you needed to have an exam done, you would have to either call the facility, like for example the hospital where you want to have your exam, either call or physically go and go to their what's called COOP, which is their central reservation center. And sometimes you would could sit there for an hour, 1 or 2 hours, just sitting there waiting your turn to make an appointment. And so you have to do either, like I said, either call or actually physically go there. Now, if you have what's called kind of like a digital ID, so your ID has been verified, you can go many regions, at least here in Lombardy, you can just go online and you can make the appointment online. That's even with the public system. I think a couple of hospitals here in the area, they also do that also. There are private hospitals that have an agreement with the public system, so you can go and sometimes be seen quicker and still use the public system. I've done that a few times. And again, the quality of the care has been outstanding. The quality of the care has been outstanding. When I admit, I didn't go to the gynecologist for like 15 years. I admit, for the first 15 years, I didn't go until I finally got my butt in. After my mother-in-law, was like, look, swear to me, Ann, that you're going to get your problematic periods taken, checked out. It's like, okay. I finally got my backside in. And when I went, the difference was, it was just a doctor. Okay, my husband came with too. But this doctor did the usual, pelvic and pap smear, of course, a breast exam, and no rectal exam like in the States. But they do standard what's called a transvaginal ultrasound. And that's how the doctor discovered this, what he thought at the time was a cyst, which turned out to be a tumor. Okay, this was at the end, middle of July. And in August, usually Italians go on vacation. And the doctor's like, okay, we'll think about doing all the exams in September, before pre-admissions tests. Well, they get a phone call in August. Nope, we want to do them now if the doctor had his suspicions that it may be cancer. So in August, went to the hospital, did like EKG. What else? EKG, CAT scan with contrast, some blood work, and stuff. And also an interview with the anesthesiologist. And again, zero, had to pay no money for that. It was totally free. Then about 2 weeks later, had to go in for some more tests. This was basically more blood work, and then was admitted into the hospital. And I'll try to put up a photo here. And it was a very new hospital. The hospital at that time had only been open for 2-3 years, and so it was a fairly new hospital, fairly new, clean. The doctors were great. Sometimes the nurses I was joking around. They had a good sense of humor, and it was a totally positive experience. There's nothing negative I can say about it. And after my surgery, I started having problems with my blood pressure, and because before, when I did the other exams like the EKG and stuff, my blood pressure was normal. Then boom, immediately after the surgery, they could not get it down, and I even had to see a specialist. And now I'm okay. Now I'm okay with the blood pressure. Now I take something with medication and it's under control. But they would not let me leave the hospital until my blood pressure was under control. And where's in the States? Oh, okay, have you go, kick your butt to the curb, and then tell you to go see a cardiologist or a specialist to get it taken care of outside the hospital. All right, no. You're staying here. You're staying here. You're not going anywhere. Um, then, um, then my husband had his first stroke in 2016. He was in for a week, and then in 2020 February he started having problems again, and first was admitted into the nearby hospital for about 2.5 weeks. Then he was transferred to a specialized hospital in Piedmont, specialized neurology, and actually specifically for people with strokes and also weight loss. And he was there for 2 months. Lost some weight because he's also obese like me, if not even more. And before he came home, they had also provided a walker. So that was, they had that delivered to the house before he got home, a walker, and that was free of charge. And and now every time he goes to the neurologist and he needs any kind of treatment it's provided by the system. It's free. Again, the doctors when he was in the hospital were all great. Social worker contacted me to set up arrangements as far as he has what Americans would know as Meals on Wheels, delivered every day, 7 days a week, even on holidays. He also has a wonderful person that comes in twice a week to help him take a shower, and that's all covered by the system with what's called what you know as welfare benefits, and we don't pay for that. It goes according to income level. And since my husband has been declared totally 100% disabled, there's no income. We don't have to pay for those services. That's all provided. And yeah, it's also the prescriptions. That's a little bit different than what Americans are used to. Every month, it depends on the doctor. You may actually have to physically go to his office every month and maybe just sit there and wait, or maybe you have the thing that you take a number and you just go in and request your medications. It's not like in the States where they maybe write you up one prescription with 11 refills and then you just take it to the pharmacy, and then after that you just deal directly with the pharmacy. Here, no. Our doctor, and I'm also just in the process of changing my medical doctor because I don't like our current one. It's like I just email the doctor directly. I email him, and then when the doctor prints via computer the prescription, the region will automatically send me an email and also a text message with the prescription number that I then email to our pharmacy, and then I just go pick it up. That's how that works. And this is all because as a result of COVID. So it's a positive, one of the positive things with COVID. And like I said, my husband's parents have spent many of visits in the hospital. My husband's mom had both hips replaced, one in Trento, and the doctor good result. Another one here locally, and again, good experience. And then after she had surgery, she spent about 1 month, it was about 1 month, in a nursing home for physical therapy. Same with my husband's dad. My husband's dad had broken his femur and fell, and he was like, 92, 93 at the time. So he did surgery, pinned his leg back together, and then he again spent about the same amount of time in a nursing home for physical therapy. Very good, very good. And totally impressed. And again, the staff at the nursing home were all very kind. And whenever you pass by them in the hallways, hi, how you doing? Smiling, and you're very polite. Very good, very good. It's the only Like one time I can talk negative, like for example, the emergency room, is that you may have to wait sometime depending on the situation. And don't worry, look at my cat. Um, but they, like anywhere, they're going to go by code. If you have, like, if you're bleeding from your neck, obviously you're going to be seen immediately. Don't worry that if you're going to lose your life. But if it's just something like you need a cast put on for, you may have to wait for the others that have priority over you. Yeah, it's like otherwise that no, it's like, you know, otherwise I have nothing negative. So I actually prefer the Italian system now compared to the American. Like I said, I will say this several times. There's no way that I could ever go back to the States because of healthcare, because of the healthcare system. So Americans, it's not, socialized medicine isn't such a bad thing. I don't know, when the pandemic first started here, so you're talking March 2020, someone that I know posted on Facebook that, reposted something on Facebook. Oh, Italy's killing its old people. That's socialized medicine for ya. So I had to say something. I was like, look, first off, where are you getting this information? Did you verify anything before you post something like this on a public platform? Yeah, it's like, it's common logic to do something like that. I go, imagine you're that doctor in that situation where you have two patients. One's maybe an healthy 18-year-old that has the possibility of spending another good 70 years on this earth, whereas maybe you have a 90-year-old. They've lived a long life, but unfortunately, physically, their body may not be able to handle this disastrous virus. What are you going to do? The doctor's in a situation. Put yourself in that situation. And the socialized medicine. Thank God for socialized medicine. I'm thankful for socialized medicine because, again, I'm alive, my husband's alive, and also his parents received outstanding quality care without having to worry about living under a bridge or losing everything just to have the opportunity to see a doctor. Oh, and also back to prescriptions for a moment. I'm sorry, but the United States has the highest prescription prices in the world, if not one of the highest. I take Tegretol every day because I also have epilepsy. And was it the last time I was back in the States in 2005 and I had to buy it without insurance? It was like about $78 for 1 month prescription. A few years ago, was it 2016, 2018? It was $180. So it more than doubled. My husband and I are also diabetic. We both take insulin. My husband also takes Trulicity. I take Zigduo, diabetic medication, and I was on metformin, but my doctor changed it. And we spend maybe $5, roughly $5 a month for everything. $5. The blood glucose monitors we use, the testing strips, the lancets, all are covered by the government. And so that's, yes, in the States, I don't even want to know how much it is. Speaking of the government and healthcare, just because the government is involved does not mean that, so they're going to say, Joe Schmo has diabetes. It's like, and so, they're like, they don't care. It's like, I don't say they don't care. It's like they care that they want to make sure that you're healthy. Think about it this way. If you're healthy, you can be a more productive citizen for society and pay more taxes. Think about it that way. But otherwise, you are not denied anything. If the doctor asks for an exam, you get the exam. Stop. You don't have to worry about some insurance company wondering, denying you have a required surgery. And you don't have to worry about the insurance company. Oh no, we're not going to pay for that CAT scan with contrast because you don't need it when you do, when to see if you got cancer or not, for example. Which or deductibles. Deductibles don't exist here unless you maybe have a private insurance. Private insurance is available here if you want it. But otherwise, no, it's totally different than compared to the States. Again, the quality of care is outstanding. See whether I think about. But yeah, I thought too. Even up until 2017, when I had my surgery, I wasn't sure really what to think about it. And then in 2017, when I had my surgery, and by the way, that was the first time I was ever been in the hospital in my life. And it was an outstanding experience. The doctor had to cut me open, actually cut me open. I had a cut from my belly button all the way down just above my pubic hairline. And when I woke up, they had me on a morphine drip. Just for the first 24 hours, catheter in, so that way I didn't have to worry about going to the bathroom. So yeah, even a morphine drip, just boom. So then, in fact, when the nurse took it off, I was like, what's that? And she's like, oh, that was morphine drip. And she goes, how are you feeling? Any pain? I go, no, I feel good. And so the second time I've had morphine in my life. But yeah, they made sure I felt no pain, no discomfort. Even the aftercare for getting the staples out. I had to go in like once a week for a while for the first month. I think it was. Yeah, first month I had to go in and get the nurses would check the stitches to make sure that it was okay, that the wound was healing okay. And they took very good care of me. They have very good care. And after that, I just been like, no. There's no way I could go back to the States. And then also when my husband was in the hospital, like I said, the hospital had their own social worker, who then after when my husband was discharged, she put me in contact with the local social worker with the city here. And no, it's socialized care and the welfare system. It works. Okay, I know it's not perfect, but I will have to say that we have less. It's usually here in Europe, yes, it's pretty standard for the public health care, and in Europe, so not just Italy, but in Europe in general, it's public, and Europeans really think negatively of the American healthcare system because it's so exclusive, so to speak. If you don't have money, you're in a bad situation. Because here they feel that, whether it's if you go to Finland, down here to Italy, to Greece, to Portugal, to France, healthcare is considered a human right and a basic need, which is only true. And I've really changed my mind about that. And okay, before you come at me about the taxes being so much higher here in Europe compared to the States, well, it's like, consider how much you pay if you have insurance. How much are you paying a month for insurance? How much is your deductible at the moment? And also, there's that risk, like I mentioned earlier, of the insurance company denying you something that you need. And and consider all that. So at the end of the day, it's like probably it maybe equal out. Also, it depends. I know where you are in the States, but consider that at the end of the day, your taxes that are taken out are less, but how much are you paying in premiums? How much are you paying for co-pays? How much is your deductible? Here, there's no deductible. Here, it's like maybe maximum if you have to pay for something. If you're maybe max going to spend $20, $30, $40 tops for an exam. It's like one time I had an MRI done. This is some years ago. I think I had to pay $40 for it, roughly. Yeah, roughly. I think it was only like $40 for an MRI. We're in the States. I could run that. The last time I had an MRI done in the States was like $700 and something dollars. I think I'll pay the $40 anytime. So yeah, there's that, the price. So don't think, but the taxes are so high. At the end of the day, you're paying. At the end of the day, you're paying about the same thing. So if you're an American that has moved outside the states into another country, what's the system like where you're at? What do you think about it? Leave your comments down below. I'd love to hear about your stories. Or the Americans that you're still in the states and you've had, I don't know, nightmares. Can you share your experiences too? I'd love hear about your stories that you have to say and share with everybody. Thanks for watching this far. See you next video. Have a good one.